used for muscular dystrophy. Next, please. Next. So basically, ang focus sa rehab FOR kay on achieving the client's optimum level of independence rather than sa biomech na FOR wherein nag-try pa sila restore sa original jud na functioning sa client. So in rehab FOR, naga-focus lang ang intervention on ergonomics and prevention, which is wherein i-make sure na ang environment ug ang task demands kay mo fit sa capabilities sa client. So next please. So here are a few intervention techniques to keep in mind under rehab FOR. So firstly kay acquisition and training in assistive devices. So of course some children with muscular dystrophy kay dili man ta sure if makabalik jud sila sa lang normal functioning, so naay times na mag-rely na lang jud sila on assistive devices. So it's important na i-train sila o maka-acquire sila og assistive devices para kay bawo sila sa paggamit. So of course nasa adaptive devices na pwede ma-use para tabangan ng mga child sa ilang pagbuhat sa ilang task. Nasa adaptive clothing, so children with this condition kay na sila problem sa ilang range of motion, sa ilang muscular strength. So, naay clothing na pwede magamit para it will be easier for them to have independent dressing para matabangan sila, para mo fit ang ilang leg brace ba or something like that. Next, please. So, pwede sad work simplification and energy conservation. So, mo na ni na i-modify ang task itself para matabangan ang child ug para di siya maglisod in doing the task. And next kay environmental modification.
Okay, so for environmental modification, basically kay ang environment na naman ang i-modify sa therapist para the child will be able to perform whatever desired occupation as independently as possible in an environment which is safe for the child. So just like what we discussed in last week's meeting na we try to make the bathroom, for example, in the occupation of bathing, we try to make the bathroom as safe as possible for the child to perform bathing. So next is another one is wheelchair modification and management. So most kids with or most children with muscular dystrophy may need to be using wheelchairs to mobilize or to move themselves. So syempre lahi-lahi man ang children. So we try as much as possible to make wheelchairs fit for a specific child and his or her condition. So moving on to the next slide. Okay, so architectural adaptations. This may also be related to environmental modifications wherein we make infrastructures or rooms accessible to children or to children with muscular dystrophy. So this may include putting up ramps for where wheelchairs could pass, or ensuring that floors in bathrooms or in play areas are slip-proof so that children won't be prone to accidents. So for community transportation naman kay this could help children and their families who usually commute to be able to learn how to move in move or to ride public transportation. So lastly, we have adapted procedure and safety education. So for children who have muscular dystrophy, we can educate them in finding ways to ensure that they are safe in whatever occupation they are performing. So that is all for the intervention techniques under our rehabilitation FOR. Next slide, please.
So another intervention that could be used is swimming. So we found evidence-based studies to support this. So according to Archer 2002, swimming as a recreational activity offers considerable potential for individuals with disabilities to engage in active lifestyle. Differing from other aerobic activities, swimming is less demanding when performed as a recreational activity since swimming does not overload muscle or joints. On the contrary, it benefits the body in terms of relaxation and reduces the stress on joints. According to Luz and Bowers 2005, they added na other than physical benefits, swimming is good for mental health as well since it makes individuals feel refreshed and relaxed. Due to their disabilities, individuals may feel less valued, less capable, and less confident. Failure in integrating this ability into their lives affect how they perceive themselves, their capabilities, and self-worth. Yeah, ni add si Conaster 2007 na there are multiple researchers daw that show that children with disabilities benefit from swimming with regards to social and psychomotor skills. And finally, Jens et al. 2010 said na delaying the loss of functional abilities is regarded as an important goal in managing DMD as it may optimize because this study specifically focused on DMD man as it may optimize independence. He argued that limited physical and social possibilities result in a secondary reduction of physical activity in the lives of the individuals with DMD. So he proposed physical training to oppose the secondary deterioration of muscle tissue and the loss of functional ability as a result of disuse. In order to keep DMD patients physically active, swimming as a recreational activity is a great option since swimming is good for improving muscle and joint function. Besides, swimming when performed as a recreational activity is a kind of low intensity activity. In addition, it's being low intensity. Swimming is a non-weight bearing physical activity which does not put extra pressure to muscle or joints. So yes, next slide.
So for the last one, according to case, those intervention techniques na mentioned earlier, gisupport siya aning journal. Especially, dili lang OTs ang mo cater sad and also mo help in order for a successful intervention para sa mga kids with muscular dystrophy. Appeal sad ang PTs, ang SLPs, and other healthcare professionals nga mo cater og kuan parehas nga nga condition. So that ends our slides. Thank you for listening.
All right. Intervention for rehab FOR is mainly focusing on the modification, di ba? Or compensation of activities. So your main goal is to increase or to return the optimal independence of your client, whether through assistive devices, whether through changing or modifying the activity, di ba? Whether through adaptive devices. So yun na na. Now, when you use rehab FOR, it's either because you can't remediate anymore using biomechanical FOR, meaning permanent na condition, just like your Duchenne muscular dystrophies ng mga children, di ba? Sa'yo sila ma-wheelchair bound, sa'yo ma-deteriorate ilang muscles, so you can use that sa ilang older age. If ever permanent na, and then if ever necessary na mabalik dayon sa independence ng client without the time to remediate. So for example, work sa client and then a disability siya or na-disable siya and then he needs to go back to work within the week kaya magtangan-tangan siya trabaho. So if there is anything that we can do to assist him, for example, modify the chair, modify the activity, that is using the rehab FOR. Okay, is that clear? So if ever mag-remediate mo, you're trying to increase the strength, range of motion, or endurance, you're using biomech already. But if you change any of the occupational na components, for example, kato activity demands or the environment, then that's rehab FOR already. So don't get confused, guys, ha? Alright? Is that clear? So you should know when to use biomech for remediation or when you should use